This chameleon came to my hospital due to concerns of not eating, lethargy, and a swollen belly. Immediately upon doing my exam, I noticed that her coelom or body cavity was distended with fluid. Here we are doing an ultrasound, which showed us that she was suffering from a condition called follicular stasis, which is one of the most common issues I see with mature female lizards, such as chameleons and bearded dragons. All of those round structures that you see are follicles, which are the precursors to eggs. The black that you see around the follicles is fluid. Normally, when a reptile creates these follicles, they will either reabsorb the yolks or they will ovulate and go through the rest of the reproductive tract, turning into infertile eggs. The problem arises when the reptile's follicles fail to regress or ovulate. When they are static, they become inspissated or necrotic and can even rupture, leading to egg yolk coelomitis. Here are her x-rays. The follicles are a little harder to see since the fluid masks them, but you can tell just how much her reproductive tract is enlarged and pressing on all her other internal organs. Unfortunately for this chameleon, we were worried about the follicles decaying in the body and becoming a source of infection. Once the coelomitis sets in, the prognosis is much worse. The treatment for follicular stasis is spaying, but due to how weak she was and her guarded prognosis, the owner elected for humane euthanasia so she did not suffer. The best way to prevent this from occurring is keeping optimal husbandry, so always double check your temperatures, humidity, calcium supplementation, and UV lights. It's also important to keep your reptile at an optimum weight, as obesity can be a contributing factor. Reptiles should also have either a focal area or an entire enclosure full of substrate to dig and lay their eggs in.